Welcome to the Committee on Government Affairs. Will the Secretary please call the roll?
Assemblyman Carter,
Present.
Assemblyman DeLong,
Present.
Assemblyman De Silva,
Here.
Assemblywoman Duran, Assemblywoman Gonzalez, Assemblyman Gurr,
Here.
Assemblyman Hibbets,
Here.
Assemblyman Koenig,
Here.
Assemblyman MacArthur,
Here.
Assemblyman Nguyen,
Here.
Assemblywoman Taylor,
Present.
Assemblywoman Thomas,
Here.
Chair Torres.
Welcome to the audience in Carson City, those joining us by video conference in Las Vegas. It looks like a packed room, and those listening over the internet. Just some housekeeping items. Please remember to silence your electronic devices. If you wish to testify, please sign in at the table by the door and provide a business card to the committee secretary. For those joining online, please be sure to mute your microphone when you're not speaking to minimize any background noise. When testifying, please turn on the microphone and clearly state your name and affiliation, if any, for the record. Then turn the microphone off each time you are done speaking. Handouts, 20 hard copies for members of the public. The electronic copies should have been submitted to our committee manager by noon yesterday for members of the committee. We expect courtesy and respect in our interactions during the meeting, even if we may not agree with another person's position. Committee members will be using their laptops to view handouts and other documents. Please do not view this as a sign of disrespect or inattention. We just have we have so much technology in front of us, and this is how we often see the presentations that we're looking at. Public comment will be taken at the end of the meeting. Each person will be limited to 2 minutes. In addition, the public may submit written testimony to the committee up to 24 hours after the hearing. At this time, all right, our first presentation this morning is with Clark County, and our presentation is going to be with Kevin Schiller, Jessica Colvin, and Joanna Jacob. Please approach the dais. While you're all getting up there, I just want to note that Mr. MacArthur got a haircut, and it looks excellent.
Okay, good morning, Chair Torres, Vice Chair Duran, and members of the committee. My name is Joanna Jacob, and I'm Government Affairs Manager for Clark County. I'm very happy to have some visitors from home with us today. To my right is our County Manager, Kevin Schiller, and to his right is our Chief Financial Officer, Jessica Colvin, and we're going to go through the slides for you this morning. I'll be driving, and we'll try to keep it quick. And we're looking forward to telling you a little bit about Clark County. So with that, I'll hand it over to Mr. Schiller.
Good morning, Madam Chair and members of the committee. Pleasure to be before you today. I'm going to go through some slides with you around Clark County. I do want to provide time for questions, so I won't read slide for slide and detail for detail, but just hit the highlights. First off, in our governance structure, obviously we work under 7 county commissioners, Chairman Gibson, Vice Chair Justin Jones, Michael Naft, Marilyn Kirkpatrick, Russ Miller, Commissioner McCurdy, and Tick Segerbloom, many of whom were in this building, so lots of experience there, and you obviously will be hearing from them throughout the session. Clark County, in terms of our overview, we're the 12th largest county in the nation. We're the most populous county in the state of Nevada. We account for 75% of our residents. Geographic size is nearly 8,100 square miles, size of New Jersey. We provide services to over 2.3 million residents and 38.8 million visitors from 2022 stats, and we employ over 9,300 full-time equivalents across 38 departments. Wanted to highlight what we're not, because there tends to be confusion sometimes. We are not the library district. The school district often is the one that gets confused. The Stadium Authority, Regional Flood Control, Regional Transportation Commission, the Health District, Regional Housing Authority, and then also the Southern Nevada Water District. Go ahead. We are the largest government agency in the state of Nevada in providing both regional and town municipal services. As you know, our regional services are provided to visitors and all residents within Clark County. This includes those that live in the cities of Boulder, Henderson, Las Vegas, Mesquite, and North Las Vegas. Examples include the world's 10th busiest airport, our air quality compliance, social service, and the state's largest public hospital, the University Medical Center. So we tend to be the safety net across many of those human services. In our town services, we provide those to visitors and residents who live only in unincorporated Clark County. These services are similar to those provided by the cities: fire protection, roads, parks, recreation, planning, and development. So a brief overview, and I just touched on this, our regional services versus our municipal services. You know, when you go across on the left side, you can kind of see district court, the coroner, the airport, social service, public defender, public guardian, elections. Those are all regional services that we provide across the county. Again, it's to over 2.3 million residents. And then we provide municipal services, which are the ones I just touched on: the building department, business license, code enforcement, public works, all those pieces that you would see in cities, to about 1 million residents. And I kind of just want to highlight this in terms of the context of that. We don't draw those lines between the municipalities and Clark County in terms of our regional services, so we are that safety net. So our population, if you look at unincorporated Clark County, you look at that across the board. City of Las Vegas is approximately 600,000, Henderson 300. When you look at that total, really what I want to highlight on this slide is if unincorporated Clark County was a city, we'd be the largest city in the state. And then I want to highlight that the Strip Corridor is an international destination, is located in unincorporated Clark County. So some people don't realize that the Strip is unincorporated Clark County. For the next section, I want to turn it over to my Chief Financial Officer, Jessica Colvin, who's going to talk about our revenues and expenditures. And as all of you know, nothing happens without money. So I'd like her to talk through that.
Thank you. For the record, I'm Jessica Colvin, Chief Financial Officer for Clark County. We wanted to give you just a breakdown of the general fund's 5 major revenue sources. We're presenting to you our general fund because that's the fund that is discretionary in nature, it's unrestricted, and it funds the majority of the county's functions. If we go to the next slide, just to give you a visual of the county's general fund revenues, you'll see that intergovernmental or consolidated tax revenue is the county's largest source of revenue. This is also the most volatile source of revenue. In that I mean when there is a change in the economy or in tourism, consolidated tax or sales tax revenue will be impacted immediately, and the county will experience those effects within 60 days. And it requires a very quick adjustment by the county to adjust expenses if revenues decline. This was the case during the pandemic. You'll see that taxes or property taxes are 35% or the second largest source of revenue. Years ago, property taxes would have been the largest source. However, due to the property tax caps, that's more constrained, and it is now the second largest source of revenue, but much more of a stable source. Our general fund expenditures, as mentioned previously, you could see several different functions are funded from the general fund. Close to 51% is dedicated to public safety of the general fund budget. When preparing the general fund budget each year, we identify what our operating revenues are sufficient to pay our contractual obligations. And then if there's growth in the revenue source, we come back to the Board of County Commissioners to determine how that additional revenue should be applied. Which leads me to the next slide, and that is probably the biggest challenge that Clark County is experiencing is growing our positions in the workforce. What we provided for you today is an analysis of looking at a comparison of our population growth compared to our general fund full-time equivalents. And if you look at fiscal year 2009, you can see that the population was 1.9 million compared to 2.3 million today. There's an increase of almost 18% in population since that time period. If you go over a couple of columns, you could see our general fund full-time equivalents, and we've only increased our general fund employees of 0.1%. Now, we try to leverage technology as much as we can, but we need people, we need positions to provide the services. So when you compare that 18% in general fund or in the population, that full-time equivalent to 1,000 residents has actually decreased 15% since 2009. Unincorporated or Clark County is unique in that we have this large visitor volume. Over 38 million visitors visited Clark County in 2022. And so we're also providing services to those visitors as well. And so you can see as visitor volume has also increased 3.3%, those positions are not increasing. And so we actually have a decrease in that same statistic. We went to Bureau of Labor Statistics, and state of Nevada ranks 49th in the number of full-time equivalent employees per 1,000 population. So with Clark County being the 73% of the population, that ranking very much applies to Clark County. So with the increase in population and visitor volume, you'll see on our next slide, these are just some examples. Each of our departments provide performance measures each year. They've been doing that for over 10 years. And just to give you an idea of how much that workload has increased in that time period. I won't read through each one, but you could see that our Child Protective Service caseloads has increased 80%, social service calls have increased 18%, and so on. From there, I'll turn it over to County Manager Kevin Scheller.
Okay, so as she just talked about, we have about 38.8 million visitors. With that, highlighting some of those areas as an international and a domestic destination, the NFL Draft in 2022, we had the Pro Bowl, 2023, Formula One. We just had board action on Tuesday for essentially a 10-year commitment towards Formula One in our vicinity. Super Bowl. And men's basketball Final Four, and there's lots of discussion on others. So with that, as we go to the next slide, I just kind of want to highlight, with all those visitors coming, and we serve both residents and visitors, we also have requirements of those visitors. So some of the things to highlight: the airport, family services, impacts around police and fire. Any of these events are significant challenges in terms of how we provide that safety throughout the Strip corridor and the region. Public Works, obviously, social service, and then our hospital tends to get a lot of those impacts also. I want to talk a little bit about Clark County in relationship to the pandemic. So the first thing I really want to indicate is, before we hit the pandemic, in our social service realm, our human services realm, and what services we delivered, and I think you guys are going to hear this a lot, the issue of homelessness, the issue of housing, the issue of rents, those were all components that we were in a deficit in before we ever saw the pandemic. So there's two things that occurred when that pandemic happened. Obviously, preaching to the choir in terms of the impacts to the people. But what I would emphasize, and I'm going to get into this a little bit, is that that pandemic from a human services perspective has not stopped. So the continuity of services and basic needs remains. The pandemic, just as an intro, did create some opportunity for us to look at how to do things different because we had to. So it kind of removed some of that bureaucracy and let us be a little more nimble as we tried to deliver those services. The county received over $900 million through federal recovery funds. You guys are familiar with the CARES Act, also emergency rental assistance, and the American Rescue Act. Those were all pieces tied to what we had to deliver. We took a phased approach in addressing both the immediate and long-term needs as we looked at the pandemic. And then although those recovery efforts have been strong, continued assistance remains in the vulnerable communities. So as I stated before, we had deficiencies prior to the pandemic. I think we've got into programmatic structures that have changed some of that. But when you look at rents, when you look at evictions, and you look at our social services net, it's not stopped. So to give you kind of a stat, in the social service realm, with the infusion of those federal dollars and what we saw come in, you had about a 450% increase in program scope in social service. And to give you a sense of those numbers, I think in our social service department, in a total of about 300 employees. So the use of contracts, the use of our internal employees, and the use of our agencies is where we tried to get those dollars to kind of create that safety net. And then the other piece I would highlight is we have to figure out what we created. We can't just turn it off. So the issue of sustainability is really significant when you shift from those federal dollars into how do we maintain continuity of services. Go Just to give you a kind of a sense of how we approached it, phase one was kind of immediate response needs, including public health, safety, and direct client assistance. Some of you know this, food assistance, housing, emergency transitional housing, all of those things as people faced unemployment and had to change how they were approaching their lifestyle, many of which who were not prepared for this. Phase two was really a continued response to the impacts of the pandemic. Again, expanding public safety, direct client assistance programs. So what happened is as we entered into the emergency, trying to figure out what's the roadmap look like so that we can continue that safety net. And then phase three is how do we use those federal funds in terms of one-time costs or service costs that can be part of our infrastructure and sustainability. So I kind of want to stop there. The issue of the social service realm and the human service realm and public safety is what's the new normal, right? So programs that existed pre-pandemic and services in that scope that existed pre-pandemic has shifted. So as we approach post-pandemic, our social service realm has to change. So we've changed the bar, we've changed kind of how we deliver those services and trying to meet the demands, but we also have to maintain the sustainability of what new normal looks like. And the way I often say this is if you go back to the 80s and you look at welfare and you look in terms of today, they're almost like night and day in relationship to eligibility and in terms of what that community impact need looks like. So what do those initiatives look like? I don't want to go through all of it, but I kind of want to highlight a couple. If you go down to the bottom of phase one and phase two, you can see we've put about $500 million out between medical, rent, shelter, and utility assistance. So basic needs became a critical component of all that we were seeing in terms of those calls that were coming in. And as we transition into phase three, phase two, one and two have pretty much been complete. We're phasing out of kind of the rental assistance component in those federal dollars into kind of a new normal. But in phase three, where we're really looking at things is workforce development, water conservation, broadband, and affordable housing. I think most of you know this. In Southern Nevada, we're about 79,000 units short, and it's growing every day, of affordable housing. I do want to highlight a couple things, though. With those federal dollars, we obviously had some flexibility in use of those dollars for program development. What we also tried to do is how we use those federal dollars to offset the county funds to create dollars that were flexible. So one of the key issues pre-pandemic and during the pandemic was how do you use dollars that don't require widget counting? So marijuana dollars already existed. We use that to address homelessness. But what I would also say to you is affordable housing, our community housing fund, we put about $120 million out to support non-federal accounting for those dollars. Sorry.
And feel free to pause if you just
Yeah.
need a minute.
Sorry. So I want to talk on the affordable housing. 75,000 units is a lot of units. With that community housing fund, one of the key pieces with that is how to dedicate with the community housing fund dollars using federal dollars to get money on the street. So that was one of our key components. So next slide. Continued service demands. So, sorry for my cough. In our affordable housing realm, Jessica, wouldn't you hit that one? Yeah.
For the record, Jessica Colvin. As we've kind of going through the recovery of the pandemic, like we said, those service demands didn't just end, when we reopened our non-essential businesses. And so we're seeing a continued need in demand for services. And so we've given you a highlight of this, the affordable housing and reducing homelessness, basic needs assistance, behavioral health is becoming more and more of a concern, child and family welfare, and down to workforce development.
And now that I can breathe, a couple other pieces I would say to you. Those service demands, the pandemic has, as it's concluded, the demand on housing, the demand on all the things we talk about. You hear a lot about homelessness. So I kind of want to divide it. There's homelessness on one side of the fence, and you look at traditional homelessness. There's also non-traditional homelessness and this issue of workforce deficiencies in housing. So those service demands and the continuity of care, what we really tried to use is use that federal money to offset kind of required federal funding programs so that we have flexibility, so we can be nimble in terms of hitting these needs, and then working with you as a legislative body to try to figure out how do we sustain, whether I'm talking about Medicaid and mental health services, or whether I'm working with your Division of Housing. And I would highlight, we've worked pretty consistently through the pandemic on all of that. Good. So I'm gonna highlight some of this. We have the fewest affordable rental homes in the country. It's a national pandemic. You guys know this in the rental assistance crisis, but I mean, this is one we're not proud of, right? This has created, for lack of a better term, a lot of issues related to how do we get money on the street quicker. So the Community Housing Fund, where we've committed 120 million, that is really about how do we put money on the street with less federal requirements, using tax credits, working with Division of Housing, but get money on the street. So we have multiple projects with that 120 million, many of which your Division of Housing is also funding. So we worked with them so that we did not duplicate those services. Chronic homelessness, I mean, ongoing issue. We are continuing to face this. We see it in the Strip corridor. We see it in public safety. We see it across the board. We are trying to be innovative. We're trying to use our social service teams, embed with the Strip, embed with the resorts across the cities, and try to figure out how to manage this. One of the key pieces in the next bullet is transitional housing. So one of the things we did is we literally took an approach of, in the world of sheltering, as you know, with COVID, what happened in COVID is the minute COVID hit, what do you think happened to the shelters? We had a spread, so we had immediate shutdowns. What that allowed us to do immediately was kind of shift into a non-congregate care model. So what we did is we went to hotels that were otherwise empty with no revenue coming and leased the entire hotel and then put services within that hotel. So when you see that 3,900 households and how we were preventing homelessness, we're either reacting to people that were homeless or we were diverting. And that's families, individuals, all both administering mental health and substance use, but across the board. And that continues today. So that's been a significant investment on our side. And back to the sustainability of the new normal, the recidivism rate in most of those is less than 15%. Community Housing Fund, I've touched on this a couple times, so I'm not going to repeat it, but I kind of want to talk about it because we've worked pretty diligently with our federal programs and the Division of Housing. You know, it's gap financing. How do we create financing for developers so that we can get things on the street, much like a private industry, and be quicker? Pre-development, rehabilitation. So the other issue on housing is you can build all kinds of housing, but if we start losing the subsidized housing, we actually have a net loss. So we essentially use those dollars to go to our affordable units that are going to be expiring, and we offer incentives so that we can rehabilitate. And we are targeting specific income levels and population. So obviously that 80 to 100% of affordable median income is where we're focusing, but we're also looking at affordable workforce housing. Land holdings is another significant area, using SNPLMA, county-owned parcels. Where can we provide an incentive as a parcel or working with BLM so that that developer doesn't have the cost of that land? So that would be the incentive. And then obviously the land trust model is another significant piece where we're also looking not only at rental and multifamily, but we're also looking at affordable home ownership. So we have two projects that we're putting forward which are really home ownership for single family homes, utilizing that community housing fund either in conjunction with land that we have, but also in conjunction with dollars that are flexible. So this is significant for us, and we believe that this fund will remain self-sustainable as we build it. We're fairly, I guess I would say, I think from a leadership perspective, we're fairly proud of this community housing fund because it's removed some of the bureaucracy as best we can while also trying to grab tax credits and other pieces through our federal programs. So I just want to do this visual because I talk about it a lot, and I just want to make sure you guys are aware. You'll see it probably in other committees. But the funding, when you look at kind of our front door, emergency services and those pieces, as you can see at the bottom, it's general fund. But as you move up that ladder and you get into transitional housing, there's things that this body has done historically and created enabling language under our AB 309, which came in the 2019 session. Our commissioners passed that tax. The thing I want to highlight here when I talked about those 3,900 residents, which is probably getting closer to 5 in terms of transitional housing and emergency needs with those hotels, between the CARES Act and the Recovery Act, there was a big gap. That 309 fund is ultimately what got us through that in terms of maintaining continuity of services, food services, emergency housing, all of those pieces that tie into that were part of that. So again, that 309 fund also had less requirements. Although it's dictated and restricted through the legislative language, what I would echo to you is it gave us flexibility to be able to program. So it really has been a lifesaver in terms of those human services, and you'll hear more about that and probably in other committees. As you go up the chain, then you get into the supportive housing realm. That's where we start getting into subsidized housing and how we can support them outside of that emergency transitional. So we're moving them into apartments, trying to get them into supportive structures. It goes without saying, and I've touched on this a couple times, mental health and substance use are huge. So obviously a large percentage of that is around supportive services and case management. And then, as I just talked about in the Community Housing Fund, when you kind of look up at the top, when you look at affordable housing, we want them to exit outside of that structure. So ultimately, we use that to build those units and make it part of a continuum of care. So what this really represents is people can come in at any one of those entry points, but it's a continuum of care on how they exit. What's not stated here, though, is what about the clients that come in that can't get to the degree of independence? What about those that need group care? Those types of pieces, long-term care. Those are all things as a county we continue to work on in terms of how we use Medicaid matching funds and our county funds to be flexible so we can increase where they exit to, because not everyone is going to be independent, get workforce training, and function that way. And then as you can see on the permanent independent housing, I just wanted to highlight again, Community Housing Fund, where we have the flexible funds, but we're also trying to figure out how we maximize that with low-income tax credit and private activity bonds, which are traditional kind of affordable housing deals. Go ahead.
So I'll give Kevin a break here. This is Joanna Jacob for the record. And just to make the committee aware, I'm going to be here with you in the Government Affairs Committee almost every day, probably, because you can see the scope of what are the issues that the county has to cover in the legislative process. We just wanted to give you a quick idea of what we're doing on community outreach. We've talked a lot in previous legislative sessions about sometimes it's difficult for people to know the scope of the services that can be delivered or provided by the county. Our current county manager, Kevin, is very passionate about the work that he does, and this has been a priority for Mr. Schiller, also for our previous manager as well, to try and get information out about what is available. I want to highlight here, this is a few things that we're trying to do. We've done a lot of community partnerships, as Kevin alluded to, during the pandemic. We have hired a Spanish language PIO, actually. So we are recently launched Clark County en Español. And so I encourage everybody to follow that effort on social media and also for your constituents. This is really aimed at our Spanish-speaking community so that we can communicate with them about what is available in the county and the issues that are of particular concern to them. We are also developing information kiosks. So we have traditional kiosks where you can come in and pay your taxes or do those things, but these are information kiosks. It's a new effort from our Public Information Office, and to kind of locate information out in the community about what is available from the county for our residents across multiple services. And really, I think I want to say we encourage feedback to the county. So when we talk about two-way conversations with the community, we're doing a lot of public forums and things where we can come and hear from residents about what's important to them. That's been very important to our current Board of County Commissioners. Just a quick note, I know you heard yesterday, Chair Torres, I know when NACO highlighted their bills that this is not probably the time to ask us about our bills, but I just want to say these are our bills that we have in the legislative session, one of which has been referred to this committee, Assembly Bill 8, so we'll look forward to having that conversation with you. That one, just briefly, is going to be looking at the makeup of the Fiscal Affairs Committee that oversees Metro. The county funds 66% of the share of Metro, and we're looking for proportionate representation. The other bills are starting in the Senate. You can see that we're addressing a variety of issues ranging from planning for an eventual Southern Nevada supplemental airport. We also have some financing, work very closely with Ms. Colvin and the Medicaid division about how can we continue to support UMC in our community, and then a bill on air quality funds, which is ultimately dedicated to how can we free up services to fund community programs. And that's sort of our legislative agenda. I just wanted to, I'm not going to read these either. These are the issues that I cover in the legislative building. This is a lot. I will tell you, we have a team of 3. Ashley Garza Kennedy was here. I don't know if she stepped out. She's back there. We have a team of 3 county lobbyists, but these are the issues that we cover. And I guess I want to provide this to you, that if you are working on any of these issues, please consider the county as a resource. We would like to work in a collaborative area about some of the things of these issues. And you can see there's some unexpected issues on, peace officers. Not only do our park police are peace officers, we have juvenile probation officers. So you think peace officers are policemen, but we also have other areas. I will also point out, we are a public employer, so anything that impacts the business community, we also look at it as a lens as a employer in our community. And this is our kind of agenda that we will have to cover. And so I will tell you, here's our emails. I know, and I want to highlight here, and you'll hear this from Mr. Schiller a lot. Our constituents are your constituents. We really believe that, and we want to work together. We know that we have the same issues. We have to report back to the same community. When you're representing a county, our county commissioners are direct liaisons to our community, so please contact us. Here are our names. I was going to put our photos on here because I know there's a lot of new people, but you'll see me most because I'm attached to the Government Affairs Committee here. So Ashley's in the audience, and then we have Jeff Rogan from who'll be covering the Judiciary Committee. So that is it. We tried to stay as brief as possible, and we'll open for questions. Chair Torres, thank you.
Thank you. Thank you for your presentation. I'll just take a moment of personal privilege, too, to thank the county for constantly working with us on constituent issues. I personally reached out to Ms. Jacob and Mr. Schiller several times about numerous issues that affect my constituents and sometimes my students, and the county is always very responsive. That being said, I know we have a long way to go to ensuring access because people shouldn't have to go through us to get to the county. But I know that you all have been very responsive and very helpful. So please, as legislators, especially our new electeds from Southern Nevada, remember to reach out to them as constituents have issues. If there's ways the county can help, there are direct lines. All right, so at this time we are open for questions. Do I have any questions for the committee? Assemblyman De Silva and Assemblyman DeLong.
Thank you, Madam Chair. One quick question. Thank you again for your presentation. I've been in touch with the county now for a while after being elected to office, and I'm very impressed with how easy you are to access. So thank you for that. But I have one question. I do want to bring this up here. It's not necessarily something that could be answered, I think, this time around. But, I have brought up the issue of healthcare access and hospital access in Northeast Las Vegas. So I'm hoping that maybe in a subsequent presentation we can discuss that issue and look at addressing a need that my constituents have brought up to me, which is having a hospital, an ER access specifically out in Northeast Las Vegas. So hopefully we can have a conversation, maybe a presentation on that matter. Thank you.
Through the chair to the Assemblyman, I think I would probably highlight 2 pieces tied to that. So as you saw in the presentation, we talked about UMC. We talked about, in terms of the largest provider of indigent care, the buck kind of stops here. There's several things that are kind of changing in the complexity of kind of how we manage indigent care in terms of the funding, which you'll hear more about. So I think a presentation would be good, and we can follow up individually. But the issue of access, whether that's diversion related to that indigent population in the homelessness world or just constituents, the reality of it is when you get into the Medicaid world and the managed care world in terms of who wants to provide those services, right? It becomes a public-private context. So why I emphasize that to you is we are kind of the safety net. So I think it's worth a conversation, and I think that's something we're always trying to do. One of the programs I think I would like to highlight is we have a mobile health outreach highway to health program, which is kind of tied to that. So more on the triage side of how do we get services into communities that are hard to impact, also the underinsured. So the other piece that people don't often talk about is the underinsured or non-insured. Those that are here that aren't eligible for medical care, they end up in UMC and there's a cost to the taxpayer. So how do we divert those costs? So I'm going to use an example of diabetes and kidney dialysis. That's a program that we're working on also. So I think in terms of access points across the region, that's on our radar. It's just a question of how we fund it and in terms of the partnership to do so.
Thank you, Madam Chair. Appreciate the presentation. From the north, it's nice to hear some details about Clark County. As far as your revenue budget, what percentage of that is the general fund? Meaning your general fund, not the state's general fund.
Over the entire county, it's close to 25%. So the remaining revenue sources are restricted either by statute or grantor.
Thank you.
All right, I'll go ahead and follow next with Assemblywoman Thomas.
Thank you, Madam Chair, and good morning. And I'm glad to see people that I actually work with, sort of, kind of, you know, as part of Clark County DA's office. Well, you know, I appreciate the presentation. My question actually has to do with Child Haven. We didn't touch on that subject during your presentation, and I think that it's something that is vital because from what I understand, we have over 100 babies that are in Child Haven right now. And I want to know what programs, possible programs that the county is looking at in order to make sure that our babies are taken care of.
Okay. Through the chairwoman to the Assemblywoman.
And please speak directly to the
Okay,
members, and don't
thank
forget
you.
to state your name for the record.
Evan
Mr.
Schiller, Clark County Manager, sorry. I'm out of practice. So I'm going to hit this twice. So my history, I started as a CPS worker, was a director in Washoe County, and human services is my world. So Child Haven or Kids Cottage, both in that shelter context, have been ongoing issues. Your timing's actually really good. We had a board presentation 2 meetings ago. One of the key pieces, so the challenge with the Child Haven population, and you kind of gave some numbers there. I asked about the census actually yesterday for this exact reason. So we were at about 83 kids yesterday and about 30 under 6, just so you have those numbers. The two challenges that we have, and the state has actually worked with us fairly well on this, is there's 3 things happening at Child Haven. One is foster care recruitment and licensure. So that's one initiative. So I'll just preface it that we're doing a lot around that space to challenge both the bureaucracy of licensure and how we make it faster, provisional licensing, paying relatives, and expediting that process. But if we recruit, we have to be able to license. So we don't want to recruit and then have a roadblock. That's one side of the conversation. The other side of the conversation is mental health. A lot of hard-to-place kids that come into that population. We work with the state for the Southern Nevada Mental Health Campus and at least 2 of the Oasis buildings to set up programs. That's been a huge relief factor in terms of the milieu of kids between little kids and big kids and violence and those types of pieces. And then the third piece that I really would highlight is siblings. So what's happening is we're not talking, the majority of our sibling placements, whether it's a relative placement or a foster care placement, it's not 2 kids typically. It's 4 kids, it's 9 kids. So if I ask you as a relative to take on a child 24 hours in advance, you're not ready to do that. So one of the key pieces we see in that younger population is disruption, because we'll place with a relative, they're not ready for it, you have to provide support and also financial support to maintain those kids. They disrupt and they go to Child Haven. So one of the key pieces, we're going to initiate provisional licensing and also payment to relatives immediately. So it will be pre-licensure. So we should see the convergence of those 3 factors actually start dissipating that, which will in turn allow us to change the Child Haven population and reduce those numbers. Because ultimately under the federal 4E, which is where we get our reimbursements, we want to capitate Child Haven down to a lower level so that 0 to 6 population becomes the exception. And then the other part I wanted to touch on is just foster care recruitment for sibling homes. You can't recruit a sibling home and say, oh, you're empty, I'll pay you when we place 6 kids with you. There's a mortgage, there's housing costs, there's those pieces. COVID has impacted that with rents. So the other piece we're looking at is in our sibling population, it's essentially the same as I talked about with a hotel. You pay for it full or empty so that we can start supporting that sibling structure. I do want to highlight one piece that's tied to this, which is when I talked about the transitional housing, one of the things is if we had not entered into our sheltering process through non-congregate care with hotels, our child welfare budget in terms of a unit need would probably be 2 more units of child welfare workers, because homelessness is the only issue that's being presented. So those sibling groups of 4 to 5 kids, because we have a diversion process, they're not going into a child welfare caseload. So we're actually controlling that somewhat. But I will say to you, the child haven population and the structure is going to be a convergence of all 3 of those. And hopefully I'll be able to present to you towards the end of the session some of those factual data that we're looking at in terms of improvement. So.
Great, thank you. And follow-up, Chair? Thank you.
Go ahead.
Thank you. And thank you for that answer. So I do have a follow-up, but I'm going to put this in here, that you will support my foster kinship bill coming up. I appreciate that. But I also have a question about the harbor. You know, we mentioned that a lot during the DA's office loves to mention the harbor as far as putting children and families back together. What is your feedback on the harbor? Because I would like to hear what the county, how is the county handling this? I think there's like 5 offices, 6 offices in Clark County that the harbor is part of.
For the record, Kevin Schiller, Clark County Manager. I'll approach this 2 ways. I think that the harbor obviously is a diversion program from the juvenile justice side of the house. So the best way I can explain that directly is with our offices and what we divert, it's a social service program from the perspective of how you're diverting and what you're doing. I think what we're kind of focused on, and I can speak to this from the county manager role, if you take human services across the board in terms of the spectrum, whether that's social service, DFS, child welfare, you've heard about truancy prevention, I'm sure, TPOP. All of those pieces is really trying to create a nexus between all of those programs to support that structure. My perspective on the harbor in terms of that is much like we approach criminal justice diversion. You know, the issue of resource and referral to provide those services is critical. But as with anything, I think it's always a work in progress. And I think that's one of the pieces that when you start something, you kind of start it, and I think we're starting to evolve. I came to Clark County about 6 years ago with really only a focus on human services. Ms. King brought me here to do that. We're starting to get to that nexus, so I think it's kind of taking it to the next level in terms of how does it meld into other program areas and across program areas so that, you know, and I think I'm preaching to the choir with you, but the issue of the DFS child is the same as the juvenile justice child. And so the younger we can get involved, the better the intervention, and that evidence-based practice I think is really critical to us. So I think to answer your question directly, I think that's part of our target goal as we approach, and I was going to say this at the end of the presentation to all of you, how do we approach things that are innovative, but we also have to make sure they're a work in progress so that we get to outcomes and track those outcomes so the dollar always goes farther. So I think it's a constant process.
Great. Thank you so much for that feedback. I appreciate it. Thank you.
All right, thank you. I appreciate that. Are there any more questions from the members? All right, thank you so much for your presentation. I appreciate it. All right, so our next presentation today is going to be from Elko County, and our presenter today is going to be Miss Amanda Osborne, the County Manager of Elko County. And just so committee members know, I am trying to get all the counties for the committee, for like that represent the districts that you all reside in. So I'm trying my best to make sure that you all get those, so that we can hear from them and you can ask questions that pertain specifically to your districts.
Good morning. Thank you for having us today, and for the opportunity to share with you a little bit about Elko County. First, I'll provide just a brief introduction to myself. My name is Amanda Osborne. I was appointed to the county manager position just about 2 years ago, so right in the middle of the pandemic. Probably the first 9 months or so were spent focusing on that, so just a little more than a year in the position. Prior to being appointed, I was the Human Resources Director, where I was responsible for leading various teams and functions, including Human Resources, Social Services, the Public Guardian, Public Administrator, and providing support to our health officer. So I guess I would just highlight that to say that in our rural and frontier counties, it's not uncommon for us to wear multiple hats and take on that workload. So a little bit about Elko County. We were incorporated in 1869, and we are the fourth largest county in the continental United States, covering just over 11 million acres or 17,000 square miles, with over 70% of our land being federally managed. According to the latest census, Elko County's population is 55,838, and although that's what the census reports, we still support a lot of the mining community, which and their vendors, which tend to be a little bit transient, coming in and out of the community while they're working and leaving, going back home on their days off. Major industries for Elko County, including mining and mining-related activities, ranching and recreation, and of course in some of our border towns, which would be Jackpot and West Wendover, we see the hospitality and gaming industries. Much like you heard from NACO and from the other counties, or you will be hearing from the other counties, we are governed by our commissioners, and we have about 430 full-time employees in 30 different counties across, or 30 different departments across the county. Just a brief introduction to our county commissioners. This year, Rex Sininger is our chair, and Wiley Bruff is our vice chair. Our newest commissioner is Travis Gerber, and we are excited to have him. He has hit the ground running for us. Like you've heard from NACO and other counties, Elko County provides services mostly for the unincorporated areas, with some regional services such as our judicial functions, law enforcement, indigent defense, social services, public guardian, public administrator, property assessment, and our adult and juvenile detention centers. Soon we will be opening our new Great Basin Child Advocacy Center, which will be serving multiple counties in our region. Services specific to the unincorporated areas of the county that are not regionalized are animal control, planning and zoning, building enforcement, and those kinds of things. Our roads department maintains over just 1,100 miles of road, with approximately 204 miles of that being pavement. This year's been a particular challenge in Elko County to keep some of our remote areas open, and thankfully we've been able to partner with both state and federal agencies to help us out there. Next, we'll give a brief overview of our funds. And much like the other counties, our general fund is where most of our operations are funded. Our total budgeted resources for fiscal year 23 are just over 46 million, and budgeted expenditures are about 42. We'll give you a quick breakdown on the budgeted revenues. Property taxes and consolidated tax are our largest sources of revenue. C-tax is about 42% of our budget, and 31% is property taxes. Expenditures by function, by and large, public safety and the judicial functions are our largest expenditures. And you may have a question about the health item there. That is actually our health plan for our employees. We do maintain a pretty generous health insurance plan, which is certainly part of our recruitment and retention strategy for our employees. Budgeted expenditures. You'll see here, salaries and benefits are obviously our largest expenditures. And just a little bit about our 2022 audited financials. I know this is a laundry list here, but I'll just highlight a couple of different things. While we are in great financial condition today, we've experienced some challenging years. Shortly after we absorbed the fire district in 2015, we have made some adjustments as far as implementing the fire district tax to help support fire suppression and wildland fire risk reduction and mitigation efforts. Many of our accomplishments for 2022 and ongoing efforts for 2023 include modernizing our technology for greater efficiency, accessibility, and transparency. Our mid and long-term facilities planning to remedy several years of deferred maintenance for our facilities. And with that being said, we've also outgrown many of our facilities to include our jail, courts, ambulance, and fire stations. We have made some strategic property purchases within our downtown corridor, adjacent to our current complex for future expansion, specifically for that judicial function. Much like the other counties, we're facing similar challenges. Some of them I touched on a little bit earlier, but today I'd like to highlight the mental and behavioral health challenges. As you all know, it's a multifaceted issue that's impacting our nation as a whole. Last October, we experienced 3 suicides in one day. One of those was a teen in our local high school. But we are working with our Rural Regional Behavioral Health Policy Board and have established a multidisciplinary task force to develop a framework for Elko County to take a structured approach to better address those challenges through collaboration with public and private partnerships. Lack of providers and lack of inpatient treatment facilities are 2 of our greatest barriers in accessing services, which is also creating issues within our detention facilities. Unfortunately, our jails and our juvenile detention facilities are not equipped to handle those mental health challenges. In addition, as Mr. Schiller mentioned earlier, affordable housing in general is also an issue. Again, really specifically in our bordering towns. Jackpot, which is north on the Idaho border, is actually experiencing some pretty significant economic growth. However, they don't have the housing there for their workforce. Again, with the recent rescue plan dollars, we are working to have a private-public partnership to build some housing there and ensure that those community members can live and work right there in Jackpot. A couple opportunities on the horizon for Elko County. July of this year, our Regional Emergency Dispatch Center, which is currently a standalone agency, created through an interlocal agreement, will transition to a department of the county. Over the last few years through E911 board and our phone line surcharges, we've made great strides to update the technology to provide better services to both our public safety agencies and the public. Just a few short years ago, we were running a basic 911 service that did not allow the dispatchers to know the location of the caller without the caller reporting that themselves. In addition, we're working with Spring Creek Association, which is a homeowners association just about 10 miles south of Elko, to develop better connectivity and traffic flow to support housing and economic development out that way. And that's all I have. I'm happy to answer any questions.
Thank you for your presentation, Ms. Osborne. I'm happy to hear that there's somebody else in the room that speaks a little faster than I do. But members, are there any questions? Go ahead, Assemblyman Gurr.
Thank you, Madam Speaker, and thank you for the presentation. Amanda, there's very few questions I can ask that I don't already have the answers to because I work with the County Commission quite regularly and they're all good friends. But on the economic development side of Elko in the county, what's the county perceived to be the biggest drawback that we've got?
I think there's multiple issues. One of the issues is certainly water. Water is we have several closed basins in Elko County, and so water is a barrier. We did develop the rail ports.
And real quickly, just for the secretary's sake, that is Amanda Osborne for the record.
Thank you. Years ago, we did develop the rail port. We do have water rights out there that we are able to transfer or sell depending on what the project is. We have done that recently. We have the new emulsion plant going in north of Carlin, so we were able to transfer some water rights to that project to ensure its development. And there are a couple of other projects too that we've been able to help out with.
What about air service?
Air service is certainly an issue. Amanda Osborne for the record. Air service is certainly an issue. The city of Elko is actually responsible for a regional airport, and as you know, Jan Baum is the new city manager, and we are actually set to have a conversation next week about that to see how the county can help that. And of course, I know there's some legislation coming forward this year as well.
Thank you.
Thank you. Are there any other questions for members? Assemblywoman Thomas.
And thank you for the presentation. I just have one quick question. I was looking over your challenges in your health assessment. Elko, do you have a problem with substance abuse?
Amanda Osborne for the record. Of course, I think all of our communities have issues with substance abuse, and by and large, we're seeing those issues again surface in our jail around mental health and all of those components. We do work closely with Nevada Health Centers and, of course, with the city, and we're developing some behavioral health programs with Nevada Health Centers to help support those issues.
All right, thank you. I was glad to hear that you do have programs that you are implementing so that this particular problem can be assessed within your county. Thank you. Thank you, Madam Chair.
Members, any other questions? Assemblywoman Thomas. I apologize. Assemblywoman Taylor.
Thank you, Chair. Good morning. Thank you for the presentation. And congratulations on the work you've been doing in such a short period of time. I have recently just been informed, as we learn and we talk a lot, that Elko County is really a more diverse county than most people would realize, and certainly myself. Do you happen to have numbers, or can you, on that, just generally what the demographic makeup is of your county? Ooh, that's it.
Amanda Osborne for the record. You're right, we are a fairly diverse county, mostly Caucasian demographic for us. We do have a Hispanic population of about 25% in Elko County. There are some, because of our geography and our ranching community, we also have a fairly large Basque community as well.
Okay, thank you very much. Madam Chair, if I may? Yes. Would it be possible for us to get the numbers on that, maybe from staff, if you would?
I believe if the county manager is not able to provide it today, yes, that's something that we can request so that we can get the demographics on that.
That'd be great. Thank you, Madam Chair, and thank you so much.
Any other questions from members? Assemblywoman Duran.
Just a comment. We had Assemblyman John Allison. How is he doing, just for the record?
Amanda Osborne for the record. As far as I know, he is recovering well. It was a bit of a rough road there for a little while, but yeah.
I'm sure Assemblyman Ellison is listening or will listen later, so I hope he's doing well as well. We had a pleasure to serve with him on this committee. I did have a couple more questions. So just kind of building off of the question asked by Assemblywoman Taylor. Since you have seen a significant increase in Latino population within Elko County, what has the county done to make sure that there is adequate outreach, specifically in Spanish, as there is a large Spanish-speaking community within Elko? And how have you made sure that we are engaging with those residents?
Sure. Amanda Osborne for the record. That is definitely an ongoing effort for us. In fact, I talked a little bit about modernizing our technology and communications and ensuring that we're sharing information with the community. And so just at the beginning of the year, we have gone through some community outreach and some community surveys to get some feedback in terms of how we can better reach those populations, and of course revise our website and our communications to include that Spanish-speaking community.
And I imagine those were sent out in Spanish. Okay, perfect. And I did have one question on a different topic. You had talked a little bit about like the impact of mental health and suicide within the community. And one of the things I've noticed, we have multiple different programs now. We have the Youth Teen Text Line. We have the mobile crisis response. Multiple different sources. We have Safe Voice to respond to specifically suicide, but other type of incidents that students might be going through. I'm just wondering, one, how that impacts ALCO. I imagine there are unique obstacles and challenges in a county that is more rural, but then two, whether or not there have been issues with those services speaking with and communicating with the county, with the school district, et cetera.
Amanda Osborne for the record. So I mentioned one teen suicide, but we actually had 2 teen suicides this fall, or last fall. And so through Valerie Quape Haskin, who is our coordinator for our Regional Behavioral Health Policy Board, and through DBPH, we were able to be connected to resources that honestly we didn't really know about. And so with that being said, I think we're fairly well connected and fairly well supported, but it's a matter of not staying in silos and sharing that information. And again, we've created a behavioral health task force, and it's multidisciplinary. So whether it's state partners, private partners, nonprofits, we are working together to address those issues, and those services have certainly been helpful. One of the other things that I'll speak to, while again, like Mr. Scheller mentioned, we're not the school district, but we are certainly there to support the school district, and they are starting a program called Hope Squad. It's actually out of Utah, but it's basically more like a peer support program and training and development for staff, and also for our school resource officers to provide some additional supports in our school district.
Thank you. I appreciate that. And I think, a couple years ago, I know we had a conversation about how we can ensure that emergency management systems are talking. And I think that the time has come for us to have a conversation about how we're ensuring that specifically student mental health programs within the state, because we have a number of great programs in the state that they're all communicating so that we can really make sure that they're being utilized the way that they should be. Members, any other additional questions? All right, then we are good. Thank you so much. I really appreciate your presentation. And we have one final presentation. We are going to make it to floor in time. Look at us. Means we could still start at 9 a.m. We have one final presentation from the Division of Human Resource Management, the Department of Administration. And our administrator is going to present Mandy Bosmith.
So Mandy is doing the presentation. For the record, I'm Matthew Tuma, the Deputy Director for Department of Administration. I'll be here for the question phase if there's anything that comes up.
Good morning. Thank you for the opportunity to present in front of this committee. We at the Division of Human Resource Management appreciate it very much. We appreciate being able to let you know what we do and what we're doing over the course of the next biennium in terms of state employment. As the chair mentioned, my name is Mandy Bosmith. I serve as the administrator for the Division of Human Resource Management within the Department of Administration. I was appointed to this position in November of 2022, so like our freshman legislators here, it's a steep learning curve, and it's a little fun going downhill. As said, with me today is Deputy Director Matthew Tuma, and we are here to provide this overview. The division structure of the Division of Human Resource Management, or DHRM, is administration, central payroll, records and compensation, employee and labor relations, Human Resources Services, and Organizational Change and Development. We currently have 78 full-time equivalents. We do have 10 vacancies at the moment. So like other departments, divisions, boards, and commissions, we are experiencing our own vacancy rate like everyone else. Our administration group houses the administrator's office, the DHRM budget process, the management of our budget, our Human Resources Business Partner Program, our Human Resources Information System. This is our software system. Currently, we are using a program called HR Advantage. And as you all may know, we are transitioning to another HRIS system, working on that implementation diligently. We work with the Personnel Commission, and we perform 284 regulation maintenance for Nevada Administrative Code 284. Our central payroll records and compensation team handles central payroll for most executive branch departments and divisions. Our central records team handles the records functions, or what you know as an official service jacket or an official employee record for most executive branch departments and divisions. And our compensation program administers and provides maintenance of the executive branch classified compensation program, including maintenance of the state's pay policies. So when you go to the DHRM website and you look up compensation schedules, those pay policies are put together by our compensation program group. Our Employee and Labor Relations group is one of our busiest groups right at the moment. Our Employee Relations group handles consultation and accountability for all executive branch departments and divisions. We also handle the Employee Management Committee. That is the avenue by which employees who are not covered under a collective bargaining agreement can file grievances under NAC 284. We work on delegated agreements. Delegated agreements with the DHRM are what departments and divisions use to be able to perform human resources professional functions within their departments and divisions. We do leave management, things like catastrophic leave, family medical leave, ADA accommodations, and the Catastrophic Leave Committee is also administered within this team. We do investigations. Those include administrative investigations, disciplinary investigations, and investigations related to complaints of sexual harassment or discrimination. And we also help departments and divisions craft their prohibitions and penalties, and then these go before the Personnel Commission for approval and adoption. Our Labor Relations Unit has been very, very busy over the last several months. We are currently in negotiations for 4 successor agreements with collective bargaining groups. We are in negotiations with one new group that has just recently gained exclusive representative of one of our bargaining units. We have 11 bargaining units currently for classified state employees. 7 of those have exclusive representation. We do administration and training of these collective bargaining agreements for all departments and divisions. We try to keep very open communication and collaboration with departments so we can help them, because as you all might know, collective bargaining is a very new concept to the state of Nevada. So we do a lot of training, we do a lot of outreach, and we do a lot of helping in terms of how the grievance process works, because it's a little bit different than the 284 grievance process, and how we can help employees navigate collective bargaining agreements and managers and supervisors navigate collective bargaining agreements. We do grievance resolution under the collective bargaining processes. We do mediation under the collective bargaining agreements and arbitration. Human Resources Services comprises what some of you may know as our agency Human Resource Services group. They do the technical, professional human resources work for smaller departments, divisions, agencies, boards, and commissions. They currently support 19 of those that don't have their own human resources professional staff, meaning they do recruitments, they do onboarding, they do all of the paperwork. They also handle investigations, they handle disciplinary matters, those kinds of things for those groups. We have our classification program. The state of Nevada currently has 1,181 job classifications statewide. This classification program manages those job classifications for the state. We are providing employment counseling, and what that means is through our HR Business Partner Program, we are standing up counseling services where employees can come to DHRM and say, hey, DHRM, I'm an administrative assistant 4, but I'd really like to become a professional engineer. How do I do that in the state? And we can provide career pathing counseling to them, show them a path by which they can get there, both through education, through licensure requirements, the departments that professional engineers work in at the state of Nevada. It's one of the beautiful things about the state. We have 39 departments, divisions, boards, commissions. There is a lot of opportunity, a lot of different jobs. It's a very diverse job market within the state of Nevada as an employer. It's a very cool opportunity for somebody who wants to career path like that. So we're starting to provide those services to folks. We have our Human Resources Certification Program that we are standing up again. This is something that, unfortunately, during the pandemic, kind of fell by the wayside a little bit. But this HR certification program is what we provide to departments and divisions, their human resources staff, as a certification from DHRM in the processes and the procedures that we wish them to undertake for our human resources system. The idea is that they do it in a consistent manner, right? So we are training them how we wish them to proceed in terms of human resources, in terms of recruitment, selection, interviewing, qualification evaluation, those kinds of things. And then we support them in the HR Business Partner Program for continuing and ongoing education, best practice, information, that kind of stuff. We have our Learn and Earn program. This is a program we recently stood up and are working to get our first folks into state service through this program. It's a program by which we are partnering with WNC, Western Nevada College, allowing for people to come into the IT series as trainees. And it's sort of a career pathing pipeline where we're bringing people in from WNC. There's an education stipend that they are eligible for to allow them to get those certifications and to move up through the series. And the idea is that we have people who are getting on-the-job practical experience, and they are also getting their certifications, which is helping to be paid for by the WNC folks. And at the end of it, we have a trained professional in state service that we can use where we need them in terms of IT. We are also working on building a fiscal trainee program with the Learn and Earn program to pipeline folks in from colleges and universities in Nevada. We have our employee onboarding and offboarding within the Human Resources Services team. We have our recruitment team, so the recruitments that are run through DHRM. This is the team that does those recruitments. They also do outreach, they do job fairs, they do resume counseling, those kinds of things for candidates for employment. And we have our veterans program. We are exceedingly proud of our veterans program. It came online in 2016, and at the time, only 1.8% of the state's workforce were veterans or identified as veterans. Since the inception, we've made contact with over 7,000 veteran job seekers and assisted with, on average, 500 resumes each year. Doug Williams, who is the individual down south who runs this program for us, is a master at helping folks who are coming out of the service translate their military experience to civilian experience so that they are marketable for jobs, and we hope that they're marketable within the state. We really try to place a lot of people. Currently, as of February 2023, 1,194 state employees identify as veterans, and that represents 6.5% of the workforce. We are also very proud that we were able to secure a contract with the Skill Bridge program through the Department of Defense. We launched that in October of 2022. We have 6 departments participating, and a total of 24 different kinds of internships are being offered through that program. We have 77 inquiries currently in the work. 7 candidates have been approved for internships, and a further 27 are under serious consideration by departments. This is a great program whereby serving service members who are getting ready to discharge from their military service can come in and do a 6-month internship with the state of Nevada in a professional or a technical job as an intern, and the federal government pays for those 6 months. It allows for them to transition to civilian life. It also allows for them to have sort of a probationary period about whether they're going to like the job we've interned them in. It's a really great program. We're really proud of it, and we're looking forward to it expanding within the state. Our organizational change and development team is something new. We have done some restructuring within the DHRM, and part of the reason for this is because, like every department and division in the state, you will hear from everybody they're experiencing significant vacancies. We're doing more with less. But within DHRM, what we're trying to do is model a more generalist approach where we have, certainly people can specialize in their certain areas, for example, classification or compensation, but we want more well-rounded, generalized folks doing the DHRM professional work in supporting our customers. And to that end, we are also bringing on this organizational change and development team. We have a diversity, equity, and inclusion program. It will be a statewide program. We're very proud to be able to offer this and roll this out. I have 3 amazing staff members working on this, and we've got a proposal, in fact, that's going before Director Jack Robb and Deputy Director Tuma in the next couple of weeks for what it looks like on a statewide scale. Equal Employment Opportunity Program, our mediation program. We have our Office of Employee Development, and this is our formal training group. They offer really significant training for leadership and for management folks. And the apex of that for us is the Certified Public Manager group, which we are exceedingly proud to be able to offer at the state of Nevada. I apologize, I used to work at a city. And we are currently on our 18th cohort. We'll be graduating in April of this year, and our 19th cohort began in the fall of last year. So we're very proud of this program and are excited to see it continue. Then we have organizational culture and workforce development studies. You may know these. In statute and regulation, they're referred to as climate studies. These are when we go in and take a look at the organizational culture, the workforce environment in departments or divisions, certain groups within those, and we make recommendations about how they can address issues in those groups, how they can perhaps provide training or provide conflict resolution or something of that nature. And then with this group going forward, we intend to do some baseline evaluation and move forward in recommendations, keeping track, trying to keep up with those folks to make sure that those recommendations were helpful, and if not, work with them so we can find something that will be helpful. And then we have our training program that is the less formal training that's offered by the Office of Employee Development, but it's mandatory training for all employees, mandatory training for supervisory employees, and then we have a lot of professional development, soft skill training that's available on our electronic learning system, our learning management system. Moving forward, we are working very hard on updates to the Nevada Administrative Code 284. These are the regulations that guide our human resources system. In 2022, we retained a consultant to perform, an outside consultant to perform an analysis of our regulations. Those of us who have served for a long time within the state are very familiar with our regulations and how we do business. And so it's always good to have an outside eye taking a look at what we do and to help us identify barriers to entry that we might not ordinarily see. And we're working on that analysis right now. We've completed the first phase of that. And we're going into the second phase. In conjunction with that and the work done with the consultant, we are working to fulfill the mandate given to us by Executive Order 2023-002. And the recommendations from our consultant will help inform proposed changes to NAC 284 to help make our program more efficient and effective. Upcoming projects in the DHRM include some heavy lifts, but things that I think that you all will probably agree are a long time coming and things that we have needed to do for quite some time. We are continuing our human resources system update, and that looks like changes to the Nevada Revised Statutes, Chapter 284, and Nevada Administrative Code 284. It looks like beefing up our HR certification and offering human resources information systems and HR process training certification for those department, division, human resources professional staff, and our HR business partner program. Again, supporting those folks out in the agencies so we can make sure we're giving them the customer service support, training, and best practice information they need. And then we intend to undertake a statewide comprehensive job classification study. So we intend to completely overhaul and update our classification program over the next biennium, as well as our compensation program. We intend to completely overhaul the state's compensation philosophy and the resulting pay policies for employees. These are what we are working for. We have a lot of big goals. We appreciate the time to bring this to you. Thank you very much, and we would welcome any questions you may have. Thank you.
Thank you so much for your presentation. Members, any questions? Assemblyman DeLong.
Thank you, Madam Chair. Thank you for the presentation. You mentioned here on your last slide, you're planning on changes to NRS. Do you have a list of those BDRs or bills that are coming forward in this legislative session?
Thank you for the question, Assemblyman DeLong. Mandy Bosmith, DHRM Administrator, for the record. We do not currently have BDR numbers or bill numbers yet. In fact, Director Robb has submitted information for evaluation and formatting, and so those are forthcoming. Certainly.
Assemblywoman Thomas.
Thank you, Madam Chair, and thank you for the presentation. Excuse me. I just, wanted to say your veterans program, as you were going through it, as a veteran myself, I know that when I was released, I stood in my living room floor and said, what now? What do I do now? So I think this is a great program. I just wanted to know whether or not you've gotten this information up to Fallon and Nellis Air Force Base to engage those airmen and Navy, I don't know what they call Navy people, any sailors? Oh, okay, all right. I thought they were flyers, but all right, I got you. Anyway, I just want to know if they have that information so that when they are ready to leave, that they're not standing in their living room going, what next?
Yes, ma'am. Thank you for the question. For the record, Mandy Bosmith, DHRM Administrator. We have two veterans coordinators. The administrator of the program is Doug Williams, and he's stationed in Las Vegas. He makes very regular trips to Nellis Air Force Base and to other surrounding bases in Southern California and in Southern Utah. We have Dan LaBarbera up here in the north, and he is tasked with going out to Fallon and going out to Northern California bases to allow for selling the state of Nevada as an employer, letting them know the process that we have, and working with them, again, to translate their military training into, using the civilian words so that us that have never served know what kind of experience they actually have. So yes, we are doing a lot of outreach. We are trying to get into other states as well to go to those bases, including Oregon and Idaho, trying to get as many people as we can recruit to come to the state of Nevada to work for us.
That's great program. And just as a side note, as an Air Force veteran, you noticed that I wouldn't know what Navy Fallon was.
Thank you. Thank you for your service as well, Assemblywoman Thomas. I believe that Assemblywoman Taylor has a question.
Thank you, Chair, and thank you for the presentation. It's really more of a comment than a question. I just wanted to applaud your division for taking on the organizational change and development piece of it as people change, as times change, and all of that, and all the pieces. And really, the Veterans Program is sort of a part of that from an extension standpoint, just the way you took us through it, and you're jumping into that. I just wanted to applaud your effort for that.
Thank you very much. We appreciate it. For the record, Mandy Bosmith, DHRM Administrator. One of the things that we have learned, and I think the two previous presenters said it very well, one of the things we've learned over the last 24 to 36 months is we can't do things like we've done things before. We must adapt. We must update. We must, to use military parlance, adapt and overcome, right? And we are finding that we need to find new and innovative ways to reach candidate pools. We need to find new and innovative ways to support current employees. And in bringing on this organizational change and development group, we are hoping to do just that. And we've got some amazing people. We've got some amazing talent in the DHRM that are organizational change and development folks that are passionate about this. You will be seeing some great programs to include our DEI program coming out, and we are very excited. Thank you very much. We appreciate it.
Thank you. Thank you, Chair.
Thank you, and Assemblywoman Duran.
Thank you, and thank you for your presentation. I was just wondering, I am a union person that works for the culinary, and I applaud that you are working diligently with the other collective bargaining partners or to do that. Can you tell me a little bit more on your process? For example, I know you had your numbers concerning the number of grievances and how many have gone to mediation or arbitration, and the second part to that question, does that affect your budget or the budget of the employer that was, that the grievance was the part of that, that entity? I want to say, because I know you have several different ones. Is that built into your CBA or not? If you understand my question, maybe I didn't.
I think I do.
Yeah,
Thank
okay.
you. Mandy Bosmith, for the record, DHRM Administrator. So the funny thing about Senate Bill 135 in 2019 was that along with that Senate bill, once it got passed, it allowed for the creation of the Labor Relations Unit within the DHRM. In fact, that's how I came to the state. I was hired to work on the labor contracts. In terms of grievances are handled step 1, 2, and 3, and this is true for all of the unions that we currently have, all of the collective bargaining agreements we currently have. Steps 1, 2, and 3 are handled immediate supervisor, division administrator, and then department head. Once they pass step 3 in that process, they go to formal mediation. So we call on the services of the Federal Mediation and Conciliation Service to help us mediate those items. And if that's not successful, then we go to arbitration. I don't have a specific number for the number of grievances that we've worked through under the collective bargaining process. I can certainly provide that to you, but I can tell you that we have participated to date in 3 arbitrations with 3 separate unions, and then we have 4 arbitrations in the pipeline. One of the things I think that you all might understand is that the state of Nevada, being very new to collective bargaining, we have some growing pains, right? And we also have new agreements. And if you've worked, so for example, in culinary, your agreements are usually pretty robust and they've been around for quite a while. Ours are brand new. So we still have some hiccups in terms of the language, right? And the understanding of the language, mutual understanding of the language and how we interpret it. And so, we have some disagreements, and sometimes we try to agree to disagree, and sometimes, the union disagrees with us in terms of our interpretation and says we're going to take you to arbitration. In terms of where that's budgeted, in the last biennium, there is no budget for arbitration or costs associated with grievance resolutions that is budgeted within the departments or divisions. There's a small budget within the Labor Relations Unit because the Labor Relations Unit is funded by an assessment for those folks that are covered by the, it's a per bargaining unit employee assessment. And so we use those funds to help us in terms of grievance resolutions and arbitrations. I will tell you that we are asking for an enhancement unit in our budget for arbitrations because we have learned that that's an expensive expense. And one of the things that we are trying to work for is to establish the ability for the Labor Relations Unit handles sort of the coordination of the arbitration to make sure everybody's where they're supposed to be. And at some point, we will have the conversation about whether a department should be on the hook for arbitration costs or whether that solely resides within the Labor Relations Unit.
Matthew Tuma, Deputy Director for the record, just to kind of add on to that and kind of give some of the clarity. There's both budgetary impacts to DHRM and to some of the participating agencies. Like Administrator Bosma said, there's no carve out for any arbitration costs in any contributing divisions' budgets or departments' budgets. That would solely reside within the Labor Relations Unit within DHRM, and they would pay for those costs out of their budget, and we're in discussions about what that's going to be going forward based off of our limited experience just rolling this program out. As far as other budgetary impacts, I mean, you certainly have staff time that's dedicated both through the grievance processes, whether it's through represented employees or whether it's through non-represented employees, and that's going to take time of both department personnel as well as DHRM personnel to work through those grievance processes. For these larger arbitrations on the larger collective bargaining agreements, that's where the expenditure burden is on DHRM, that they recoup those expenses through the labor relations assessment that was added in the last biennium. So DHRM is primarily funded through 3 assessments that were funded in the last biennium. The personnel and payroll assessments were pre-existing, and they funded the initial startup costs of the labor relations unit in the biennium in the previous biennium when we rolled it out, and now those are recouped through that separate assessment.
Thank you for that. Just one follow-up. And I appreciate that. And I know sometimes working with your unions as far as openings, there is like in your CBAs that you can do promotional language for your current employees. And it sounds like you do a good job in recruitment with that. And I appreciate that for our state employees. Thank you.
Thank you. Are there any other questions? All right, thank you so much for your presentation. We appreciate it. The next item on our agenda is public comment. Each person has 2 minutes to provide testimony. Public comment may be submitted in writing to the committee up to 24 hours after the hearing. At this time, I'll invite anybody wishing to testify in public comment here in Carson City, up front, or in Las Vegas. If you wish to participate telephonically, please dial 669-900-6833 and enter 874-357-08480, and then press pound. I see no one wishing to testify here in Carson City and no one in Las Vegas. BPS, do I have anyone on the line?
Yes, thank you, Chair. To take your place for public comment, please press *9 on your phone to take your place in the queue. Again, if you wish to participate in public comment, press *9 now. Caller, you're unmuted. Please go ahead.
Good happy Thursday morning. My name is Dora Martinez. Good morning, Madam Chair and the rest of the awesome, beautiful, handsome committee. I'm here to speak for public comment regarding NRS 284.012. And this is regarding the 700-hour program for people with disability in the state of Nevada. While it's doing okay, after a 1-year probation mark, only 53% of those people with disability are able to move forward, which is, pretty. It's not good. And then there's a bill that's coming forward soon. Let me see my braille notes. It's acting up. Assembly Bill 79, which I think it'll come to this committee here soon, pertaining to that 700-hour program. And I was really hoping that we would be that people with disability will be included, and that way we can talk, about us with us, and nothing about us without us. You may be aware that 25% of the population in America are disabled folks, and I believe there's over 100,000 people in Nevada who are disabled, and some of us are able to work. However, it's just very tedious to navigate the DEETR program and the vocational rehabilitation program. So those are my public comment, and thank you for all that you do, and take care.
Thank you, Ms. Martinez. Always good to hear from you. BPS, is there anyone else on the line?
Yes, Chair. Caller, please go ahead.
Anne Marie Grant for the record. Many of you may know me, but I see there are many new elected officials this year. My brother, Thomas Purdy, was 38 years old when he had a mental health crisis at the Peppermill Casino in Reno. He asked security for help. Instead of helping him, they called Reno PD, who also did not help him. Instead of helping him, he was non-aggressive, non-violent. He just simply was delusional and thought somebody was trying to kill him. Instead of helping him, Reno PD put him in a hog tie, which every page of the Rip Hobble restraint manual says never used to hog tie a human being. They brought him to the Washoe County Jail, where he was still hog tied 40 minutes later and asphyxiated by 4 deputies when they put him face down while still hog tied, all on video. He was provided no medical care by the deputies or the medical staff at the jail. He was one of 3 men who died within a 1-year period by means of asphyxiation at the Washoe County Jail. None of those deaths got an investigation. The jail death rate at the time was 600 times the national average. I've been receiving emails from someone incarcerated at the Washoe County Jail, Roger Hilligus, and I'm very concerned about his medical care and the medical care of the other inmates there. And I think that every elected official should be highly concerned. My brother died at that jail, and these complaints need to be investigated. Thank you.
Thank you for your testimony. Is there anybody else in public comment?
Chair, the public line is open and working, but there are no additional callers at this time.
All right, thank you. I appreciate that. Before we adjourn, is there any remarks to the members? Assemblyman MacArthur had spoken to me about a MacArthur minute, so I just wanted to open an opportunity for you to speak. He decided that we're not starting it today, so it might have to wait till next week. As a reminder to the committee, the agendas have been posted online for tomorrow. We do have another full day of hearings, so please be ready, and I hope you all have a good rest of your day. This meeting is adjourned.